Hi. Do you mind starting by introducing yourself, please?
Hi, I'm Rajat Khosla. I work as Human Rights Advisor for the World Health Organization at the headquarters in Geneva.
And thank you very much for doing this conversation with us. In the things that you've seen and the position where you are, what are some of the areas of focus or some of the policies you've seen that cause you the most concern?
I think there are a few, but I also have to say there are a few issues which were there already at the start of this pandemic, and the few that are emerging as we are getting into the next stages of the pandemic. I think the one thing that has been there, that was there at the start, that is there now, that concerns me a lot is issues related to stigma and discrimination. Stigma against affected populations, stigma against healthcare workers, stigma against population belonging to certain ethnicities is very profound. And the backlash that some of the communities are facing is phenomenal. And I think this is where we need to be very cognizant of the kind of challenges that people are facing. The second thing that actually concerns me tremendously is issues related to gender and gender differentials, but also violence and abuse against women and girls. The data on this is abundantly clear in terms of heightened risks of violence that women and girls face because of confinement situations that are being implemented around the world, but also in terms of the lack of protection for female healthcare workers, as 70% of global workforce is female. But the levels of protection that are available to them, from basic PPE equipment to the kind of working conditions, etc., is abysmal in many places, and more needs to be done in relation to that. And then finally, I think it's worth noting is issues in terms of shortages in relation to supplies and equipment, and how unprepared we were as a global health community, although there were warning signs all through in multiple ways, shapes, and forms, but also more strongly issues in terms of the way quarantine and restrictive measures were being implemented in different countries. The excessive powers that were being assumed to implement lockdowns and other quarantine regimes that were being implemented are of course, one can argue essential to curb the flow of the pandemic, but at the same time, the safeguards that are required, the issues of proportionality, the human rights guarantees, the issues in terms of what checks and balances are there available to ensure that abuse doesn't happen in relation to that are extremely important, but are very ad hoc in the way that they were understood and implemented. And I think, to me, these are the set of issues that for me present and continue to present extreme challenges. Now, I do want to add a fourth point to that, and this is where I wanted to say, as the pandemic is progressing, but as we are also as a global community going from one phase to the other and looking into a future, one of the things that to me is extremely telling is the issue of the use of technology, which is extremely important in terms of trying to deal with the sort of issues that we are talking about, but at the same time, guarantees and protections for privacy and confidentiality, data protection, and the human rights safeguards that are inherent in terms of any such large data measures that we are talking about need to be, embedded into the discussions now rather than later on.
And are they becoming embedded into the discussions, or is that something that you think people really need to pay attention to?
Increasingly so. In my institution, definitely. I think these issues are very much as part of the reckoning. And I know also there is a lot of work that is going on in terms of the multilateral institutions understanding the whole issue of AI, tech, and data more broadly in terms of the global sphere that we are operating in now, but more appliedly in context of COVID. What does this mean? And how are we going to be looking at these issues, recognizing that the risks involved are way too high, and that we need to put in these checks and balances and safeguards right from the start.
And are you seeing human rights frameworks being helpful to that?
Yes. I think human rights frameworks to a large extent provide the necessary parameters in terms of what the normative requirements are in relationship to data privacy, confidentiality issues. But to be honest, I think as I look back at some of the core instruments of international human rights, one does wonder whether they are fit for purpose for the world that we look upon as we look into the horizon, into the future. I think a lot of those issues have a very different manifestation in the world that we are looking at right now. I think there are normative gaps. We do have the standards to apply in the world, which is becoming increasingly far more virtual.
Are there good examples that you've seen, whether in terms of WHO or the UN or some governments that are doing things effectively in the context of addressing COVID, that are things that would be lessons for other places? You have kind of a bird's eye view where you sit. So really it's a question about if there are good examples that it would be important for people to know about.
No, definitely, and I'm not speaking for my institution, and I do have a natural bias. I think they are doing a phenomenal job with the limited resources that are available to the World Health Organization. I think it's done a sterling job, from weekly briefings to providing people and the world community with credible data, with guidance in terms of essential services, their continuation, or whether it is in terms of targeted guidance that is needed in terms of addressing population-specific issues, whether it is incarcerated populations, refugees and migrants, and so on, in an environment that is full of rumors and in terms of misinformation. I think having an evidence-based scientific institution providing that kind of information on a regular basis has been, I think, a huge win for the global health community. And I very much hope that continues to be the case as we move along.
Okay.
Thank you. It's a pleasure, Sophia. Thank you.
Thank you very much.
Bye-bye.